Good morning, good afternoon, everyone. This is Andy Reese, Department on Disability Services. We have about a little over 130 people with us right now. So I want to go ahead and get started. Thanks to everyone for joining us. We are going to start our meeting with some questions for DC Health. And actually, before I turn it over to DC Health, I do just want to review. We sent some guidance. We posted some new documents on our website and sent these out to our providers this week. People who were able to see the mayor's press briefing on Wednesday would have been aware that she issued a mayor's order this week. And that mayor's order applies to all of our placements in that it applies to practices in intermediate care facilities, residential habilitation placements, and supported living placements. The mayor's order also designates individuals who provide direct support services within any of those residents or facilities as essential healthcare providers necessary for the district's response to the COVID-19 public health emergency. That is important language because it provides for our provider agencies the same kind of flexibility that Department on Disability Services, DC Health, a number of different agencies in the district have as it relates to some of the leave provisions in the CARES Act. The people may be aware that the act that Congress passed included additional leave for some people where if the person has had an exposure or for people who, because their child is out of school or out of child care and unable to work or unable to telework, have to remain home. It provided for 12 weeks of leave there. It provided for leave to cover the time that a person would have to self-quarantine if they have a contact with a person who has COVID. Those requirements are agencies that have staff who are defined as healthcare providers necessary for the response to the COVID-19 public health emergency are exempted from those requirements for those staff. It's a really important exception because, for example, when you have a home where a person tests positive, the staff then have had contact with a person who tested positive, and therefore that staff can continue to work. And the requirement that they be allowed to take 14 days of self-quarantine that they take leave do not apply in those circumstances. The mayor's order also establishes protocols for the safety of employees and the people that live at these placements that we've identified. It also imposes a requirement that providers inform the appropriate district government agencies that oversee the delivery of their services at those placements when any staff member or resident tests positive for COVID-19. This is something we've been asking our providers to do. Some have still not been providing names of people. This does require that that information be provided to us or to DC Health in the case of an ICF. And it also, for people that were not aware, the public health emergency in the district at this time has been extended through May the 15th. The mayor did mention in her press conference that she has authority from the DC Council at this time to extend all the way up to June 9th, but she'll wait until closer to the May 15th date to make any announcements about any extension beyond that. This order takes effect today. It took effect at midnight or 12:01 a.m. today. And let me just briefly go over for people the what it means in terms of that it established protocols for the safety of employees and people that live in the placement. This includes and just so people are aware, that this order is available on coronavirus.dc.gov. We're converting it to a document that is accessible, and it will be available on our website as soon as we have the accessible version. So the requirements in the order regarding these placements are to exclude visitors and non-essential personnel from entry or access to the residence, to screen all individuals, including employees and essential visitors, to prohibit the entrance of anyone who shows symptoms of infection with COVID-19, and this screening should include a questionnaire on whether the person is currently exhibiting or has recently exhibited COVID-19 or flu-like symptoms, or has been in contact with a person recently diagnosed with COVID-19, as well as a body temperature check. Emergency personnel, of course, are exempted from this, but all other people who visit the facility for any reason are not. Exclude from the placement any employee or essential visitor who has a fever or exhibits symptoms of COVID-19. Screen all people who share a common area, such as eating together, or restroom facilities, for their symptoms. There is a provision saying no universal testing shall be conducted for research purposes, but shall be undertaken only for the care of people and prevention of the spread of COVID-19. So it does anticipate the possibility of people implementing testing. People could talk with DC Health about that. There are guidelines currently regarding testing of people, but this anticipates some universal testing that would go beyond that. Require that each person who enters the placement wash their hands with soap and water for at least 20 seconds or disinfect their hands with an approved sanitizer before being allowed to fully enter the facility. Cancel any group activities except for those that are required to address a medical need. Encourage employees and residents to practice social distancing, including no unnecessary physical contact, certainly not shaking hands. Provide adequate sanitizing products, including hand sanitizers or disinfecting wipes at all entry and exit ways and throughout the residence. Restrict seating in communal dining areas and allow people to pick up grab-and-go prepackaged meals or provide in-room dining. If not feasible, appropriate social distancing practices must be followed, such as staggering meal times, spacing individuals at least 6 feet apart. Encourage and facilitate the use of electronic communication platforms for video conference or telephone visits with residents. Implement regular disinfection procedures for cleaning high-touch surfaces and any shared equipment. And require individuals who've left the facility or residence for care at a hospital for COVID-19 or for any other approved reason to be allowed to return to the facility or residence. Also, the following protocols must be in place for the safety of the workforce and their residents at all placements. Inform all employees in writing that they should not come to work if they are sick and of any applicable paid leave provisions. Inform all employees in writing of social distancing protocols. If feasible, separate all employee workstations by at least 6 feet or stagger employee shifts to maintain social distance. Require all employees providing direct care to people or directly involved in food preparation to wear a mask or face covering. Facilities and residences should request masks if the facility or residence is not able to procure such items from the local strategic medical supply, which would be from HEPRA. And the Emergency Operations Center shall respond to these requests as soon as practicable if supplies are adequate. Ensure that all employees have consistent access to running water and soap, tissues and lined trash receptacles, store-bought alcohol-based hand sanitizers that contains at least 60% alcohol if permitted in the facility, and disinfectant sprays or wipes. And to implement the following practices to mitigate the risk of transmission. Any employee witnessing an individual exhibiting symptoms shall notify the person in charge of the placement. Direct individuals exhibiting symptoms to medical care or secure such care and determine or direct the person to determine whether testing is available. Inform the appropriate district government agency. When notified that a person has tested positive with written verification of the positive test result, implement a protocol in accordance with guidance from DC Health. Require employees who've had confirmed COVID-19 positive test results to present to their supervisor written documentation that they are approved to return to work. So all of the guidance, there's some more specific things, but all of the guidance is available in the mayor's order that is available at coronavirus.dc.gov. We've sent this out to all providers, and it will be available in an accessible format by early next week on our website. So after that rather long introduction, I would like to now turn it over so that they can respond to questions that people had that are DC Health related. I believe Sharon Mebane is on the phone, and Sharon can introduce the staff that is available with her. I believe Dr. Emily Blake from EPI will be with us as well, and maybe Erica Walker. But if Sharon could introduce the staff that can respond to questions, we can go ahead and get those questions started. So good morning, Sharon.
Good morning. Thank you, Andy. First, I want to thank everyone on the line, the providers, the service coordinators, for the job they're doing, their efforts in protecting our most vulnerable residents, protecting their health and safety, and also helping with the spread of this virus. Today, we have Victoria Alabi. She is in HEPRA, and she is responsible for the PPE. We also have Daryl Hawkins. She is with EPI. So, and they would try to answer all your questions. Thank you. Oh, and also Erica Walker, she's here as well.
And we also have Tanoa Hampton on the line. She's Executive Director for the Board of Nursing.
Okay, good afternoon. Is there a process in place for staff as well as people that we support to offer protection to both from the COVID-19 virus by way of masks and gloves given? Who provides these necessary materials?
Hi, everyone. This is Victoria Alabi. Again, I'm the program manager for the Health and Medical Coalition. First wanted to echo Sharon's comments about saying thank you for what you all are doing on the front lines. We here at DC Health are doing our best to advocate for all of the different healthcare types, but I understand that there are specific challenges with the populations that you all serve, and I understand that you all are being very diligent and creative during these stressful times. So I just wanted to say thank you all for what you are doing. For those of you who are not familiar with the coalition, we are a coalition that represents hospitals, skilled nursing facilities, clinics, dialysis centers, and of course you all, anyone that's providing healthcare services to our residents and visitors in the district. One component of what we're doing is, as we do lots of components for this response that includes planning and information sharing, is resource coordination. And one of the resources that we are coordinating for this response is personal protective equipment. What we've been kind of messaging to our members, and this is the message across the country for jurisdictions like DC, is that the cache of PPE that we have, we received from the federal government, what's known as the Strategic National Stockpile, and in that stockpile is an assortment of PPE and medications, depending on the needs of the emergency and the stakeholders within the jurisdiction. We do not receive a steady shipment of PPE. It comes to us as we request it, but it also comes as available. So we are much in the same boat as you are in terms of not being able to get full orders met timely and to the extent as which you need them. And so what I like to tell our members is that we are absolutely here as a resource, depending on availability, but we encourage all of our members to prioritize their primary and secondary suppliers for PPE. Our process is generally for those that are interested and are in need to fill out a PPE assessment form. Many of you have filled out that form. If you are unfamiliar with this form, it's a form that we use to ask what your needs are based off of your daily burn rates, your population, if you're doing aerosolized generating procedures. If you have not seen this form, you can access this form by emailing the coronavirus@dc.gov email, and we will send that form over to you. After we receive responses from that form, we take it, we analyze it and group it according to several different factors, and then we, based off of availability, try to meet the need with the available supplies that we have. We've received questions about, why haven't our requests been met at 100%? So, for example, if we're requesting 100 masks, we only received 20. As you all can imagine, we are trying to distribute limited resources across all of the various healthcare types to include your very important population. And so we absolutely understand the need, but unfortunately, because of availability, are most likely not going to be able to provide the 100% of the need that you have all identified. Again, we are doing our best to, as we get these resources in, distribute them to you all. Again, another point that I want to highlight is in one order, we may be able to provide surgical masks, and then another order, we may be able to provide gowns. But again, distribution is based off of the allotment that we receive here at DC Health. So we will do our absolute best to distribute based off of the available supply that we have, but we do encourage, because we know you all have relationships with one another, that you feel free to reach out to one another based off of the need that you have, and encourage that you all share amongst your population. Thank you for the opportunity to provide that update.
If a staff person has been exposed to a person who has COVID-19, what is in place in terms of securing their job? Are they expected to use their own sick leave and act to quarantine for 14 days?
So if I could say, DC Health could have a response to this. This is partly addressed by the mayor's order, which is that direct care staff who are exposed don't have the same access to the 14, or the same requirement for the 14-day quarantine, which under the law, if you're required to quarantine, then you do get paid for that period of time. But many staff who've been identified as necessary for the district's response to the COVID-19 public health emergency, and more specifically, healthcare providers necessary. And for this purpose, many of us are being designated as healthcare providers necessary for the district's response to COVID-19. Then that time to self-quarantine doesn't apply. We have, in fact, had some folks, and maybe Sharon could talk about this, because I've heard the real-time planning of this, where we've had folks who were exposed and those people were told to self-quarantine outside of the time that they're continuing to support the person who they had contact with. And maybe Sharon could share the guidance, the specific guidance that was given there.
I believe that the guidance from EPI is that if you're working with someone that is tested positive, then and you are not symptomatic, you can continue to work, right?
Yeah. So this is Daryl Hawkins from DC Health EPI, and when it comes to same guidance for healthcare workers, also CDC has this: when there is staffing issues, that if a individual is exposed to a positive COVID-19 person, but they are asymptomatic, it is feasible for them to continue working with, if staffing level permits, restricting them from direct contact with individuals that are severely immunocompromised, like transplant patients, oncology patients, et cetera. In addition, we did just release guidance on universal masking policies, and I can speak a little bit more to that, but it seems like from the questions that your folks have read that. And with universal masking, that is also helpful in terms of those that have been exposed and are asymptomatic. However, if somebody was exposed and becomes symptomatic, that's something else, and we would want them to not have direct contact with individuals.
For employees that are exposed to a client that tested positive, are they tested?
So this is Daryl Hawkins again from DC Health EPI. Our prioritization for testing are healthcare providers who are symptomatic, and mostly people who are symptomatic. I know that I was trying to type into the chat the answer to that. Someone else asked that as well, about testing individuals that were exposed. If they're not symptomatic, that is not part of our prioritization for testing. However, one of the things that someone pointed out in the chat is the concern for asymptomatic person transmission. And while I understand that, one of the ways to also mitigate that is to ask people to do source control, meaning wearing a cloth face covering or a face mask. And other, if a facility or a group still wanted to test asymptomatic persons, which we do not recommend, they can also certainly explore that on their own with other private testing providers. Yeah.
Another question regarding PPE. Is it possible for you to work with the providers to purchase bulk PPE from a distributor?
Right now, our priority is managing the SNS allotment that we have through the federal government.
Can you define, you said SNS?
Yes, that's the Strategic National Stockpile that I referenced before, and that's the allotment that we get from the federal government. That's the managed inventory that we are working through right now. If associations or others want to work together to put in bulk orders, that may be something for consideration. But here at DC Health, we are prioritizing PPE through the Strategic National Stockpile.
Okay. A number of people living in our homes are asked if they are allowed to be in shared living spaces if they maintain social distancing and wear face coverings.
Oh, sorry, repeat that last part. This is Daryl from DC EPI.
A number of people living in our homes are asked if they are allowed to be in shared living spaces if they maintain social distancing 6 feet or more apart and wear face coverings.
Hi, this is Daryl Hawkins from DC EPI again. So if, in terms of shared living spaces, maintaining a distance of 6 feet apart, wearing a cloth face covering. Those are all, the cloth face covering is helpful for source control. And additionally, I would continue to encourage people to also limit the amount of people in that shared space as well, and continue to do cleaning and disinfection of those spaces, meaning cleaning the surfaces, high-touch surfaces on a regular basis. And I think then at that point that's reasonable if all of those things are in place.
Okay, we're looking in the text box for additional questions.
While you're looking, there's been a couple questions that we received lately regarding cohorting, moving residents from one location to another, and if that's allowed. And I'm speaking about those that are licensed within the District of Columbia. And so these, if you want to do that, for example, if you want to cohort positive cases to one location, and they may come from different homes, you can do that under our licensure requirement, but there are certain things you have to comply with. You must. You want to talk about that, Erica?
Hi, this is Erica Walker. So in order for that to happen, you will first need to make a request to DC Health, and your request will be addressed to Dr. Sharon Lewis. She's the Senior Deputy Director for Health Regulation Licensing Administration, and we'll add this information in the chat too. So basically your ask is you're asking for the number of people to move from the current location to the new location. We would need the address for both of those locations, and you must also indicate in your request that the cohort is due to COVID-19, so that we can include that information as part of the waiver agreement that we have with Center for Medicare and Medicaid Services. And you also need to include in that letter, in that request, that the persons will return to the DC facility within 30 days after the lift of the public health emergency. So that information will be important for us to know in order to approve a request for any licensed facilities in the District of Columbia who has an intent to cohort. And please note that the cohort will be allowed to take place if it's in another state. For example, if the provider has a facility in Maryland, you will be able to cohort the people in Maryland. You just need to indicate that in your request. And if you have any questions about the cohort, you can contact myself, Erica Walker, 442-4781, or Sharon Mebin on 442-4751. Thank you.
Is there a plan to ramp up testing at more sites or give to PCPs at this time?
Oh, hi. So this is DC Health Epi, Daryl Hawkins. So I actually just typed in this answer in the chat. But yes, DC Health continues to try to increase the testing. Our public health labs have a very quick turnaround of 24 hours when we do get testing. And additionally, like I said, we have the prioritization for testing. And any person that is symptomatic, or any of your providers that are symptomatic, please encourage them to go to those testing sites. In addition, they can also call the Epi hotline, and we can try to facilitate that testing for all of your for all the people here that are symptomatic, your patients and your staff. So the number for the Epi hotline I put in the chat, but again, it's 1-888-349-8323, and that is a priority for us, yes.
Okay, we're looking at additional questions to ask.
At this time, At this time, I don't think there are any more questions specifically for DC Health, so we're going to move into DDS questions. Is there anything else? Oh, I'm sorry. We're going to move on to our next thing. I'm going to turn it back over to Director Reese.
So we had asked Sawita Bullock, who is from Holistic, if she could talk today about the measures that Holistic has implemented in their placements in terms of preventing further spread of COVID-19. Holistic had a couple of people test positive, I think 2 or 3 people test positive. They looked at their practices across their placements. They sort of looked at what they could do to stem that tide, to flatten their own individual curve, as it were, developed a plan, discussed that plan with DC Health and with DDS, and have implemented that, and it was a really comprehensive plan, and I just thought it might be helpful for them to discuss that with other providers today to give other people the benefit of how the implementation has, what the plan was, how the implementation has gone, and sort of what their progress is so far. So Sawita Bullock, who is their compliance director or compliance officer, is with us today, and we've asked her to talk about that. So Sawita, if you could go ahead.
Good afternoon, everyone, and thank you, Andy. Can you hear me?
Yes.
As Andy said, and we have worked on a plan to address the spread in our particular settings. We have ICF, waiver, and ResHab settings in day and residential, and we wanted to put together something in collaboration with DDS and DC Health to try and mitigate the spread. So approximately March 13th, we suspended all our day services and pulled all our persons from their day programs, and really just started following, there wasn't that much guidance at that time. We implemented temperature testing for all our staff coming on shift, and also twice daily temperature testing for the persons, as well as social distancing and the other guidelines we'd received. Around April 2nd, one of our persons tested positive for COVID-19, and we had subsequently 2 other persons tested and one of our staff people tested positive. As we had been following all the recommendations and the guidelines and not attending day programs, and were limiting the access of other people in and out, it seemed evident that the staff were bringing the virus into the homes. As we all know, our staff work for multiple provider types and are often not forthcoming about this fact when we ask. So as a result, in consultation with DDS and DC Health and the IDTs, our medical director, et cetera, we made the decision to quarantine our homes for 2 weeks, starting a rolling lockdown on April 8th. And by quarantine, we mean pretty much everything that was in the mayor's order. No in and out unless it was essential. Staff would be in the homes for at least 14 days. We wouldn't be changing out the staff. Food would be developed, and we put together a complete plan. But we also had to create a system. It was essentially a shelter in place. We also had to create a system for telemedicine, video check-ins, food, medical and other supply deliveries, communication with the staff. I mean, it was definitely an interesting process. And so there were a couple of things that that I think that we've learned, and this is a daily, we're finding out new things every day. Communication with our staff, with our IDT, with other providers, with the state agencies that oversee us. We just found that the more we talked and shared experiences, the more we could really sort of narrow down the different things to try, best practices, suggestions from other people, and really just talking through the process helped us to develop it. There's certain things we have to do, like I said, the bulk supplies. What we did specifically, we were signed up for, I think it's restaurantdepot.com, because we still have to get food to, not the supplies for our persons, because we had a good 2 weeks of that, but the staff, the supplies for our food persons. We signed up for restaurantdepot.com. It has a lot of supplies, not just food. It has cleaning supplies. It has paper products, a lot of things that we were having that we were having a really hard time finding. We have 24 homes in the district and in Maryland, so we really needed a way to centralize purchasing where we knew people could get the supplies that we needed. We set up a COVID-19 task force within our organization. It had our medical director, a Q, house manager, RN, the DON, compliance, finance, our purchasing managers, and we have weekly conference calls just to make sure that we're on the right path. We also set up smaller cohorts with our RNs who would talk at least every other day, our QIDPs at least every other day, and our house managers at least every other day. And it's a lot of conference calls. But what we found is that different house managers or Qs or RNs or whomever are having different experiences. And the more that we're talking about it, the more that we're streamlining our process and our procedures. One of the things we did also find is it makes a difference what hospital you go to. We had 3 people going around the same time, 2 to George Washington and 1 to Washington Hospital Center, and get tested. Washington Hospital Center took 7 days to get us the results of the test. George Washington took 3 days. George Washington was also really, really easy to communicate with. They updated us. Now, I understand Washington Hospital Center is slammed, so they don't have the bandwidth perhaps, but it made it very difficult for us to get an idea of what needed to happen. Is this person positive? Are they going to come home soon? Do they have any other issues going on? Obviously, this is when you're going by emergency services, you don't really have an option. But if for some reason someone does not require 911 and we take them to hospital, we've been taking them to George Washington Hospital Center. The other thing is the provider coalition. I think somebody had asked the question about bulk buying. We're members of the coalition, and it has been extremely helpful for us. We got an email, I believe, on Wednesday that they were putting together a bulk order. And so we placed an order which we should be getting within the next week. They found a vendor and got all the members together. I know that they got assistance also from DC Health Link in terms of figuring out how best to do this. But we were having a real hard time, as I'm sure all of you were, in trying to get the PPEs and trying to get the quantities that we needed. The other thing it was communication from the agencies, DDS, DC Health, and all the separate departments. I mean, initially we sort of were kind of trying to figure it out a little bit because, I mean, this caught everybody flat-footed. So we were a little unsure about what kind of guidance or if we were getting any guidance and how to really move forward as an agency. What do we do if we want to quarantine, if we want to shelter in place and want to take these actions? Is it going to be allowed? Are we going to have problems when it comes to audits? Is there going to be issues with HRC and a bunch of other things? And sort of it felt like we weren't getting guidance that synthesized information from all the different sources, from CDC, World Health Organization, DC and Maryland, et cetera. Having said that, I mean, when we reached out to Winslow, Sharon, Erica, Kirk, just Kwapma, the whole, I found that as long as you're in constant communication, we get answers. And so what we started doing was, we want to do X, Y, Z. What do you think? Do you think? And we got a lot of assistance and help that way. I know that, especially now with all the notifications we're getting from DC Health and from Kwapma and coronavirus, what have you, it is a lot smoother of a process now. The other thing, an additional thing of many, we are all getting a lot of information, requests for information from these agencies, and it sometimes can seem a bit overwhelming. It's a lot of, while you're trying to manage this process, your burn rate, I'd never seen a burn rate before, but that was me. But what I have found is that when we send the information back, the agencies act on it. So, I mean, I know that when we notified our one location that had a positive test, we got DC Health delivered PPEs to us the next day, to the location at the door the next day. So we really make it a point to provide the information that the agencies are asking for, because this doesn't work without collaboration. You've got a lot of different agencies, a lot of different providers, vendors, and we're all sort of figuring out together. And as I said, we've had a really good response when we provided information or asked for assistance. The couple of more things, telemedicine, teleworking has actually been surprisingly successful, might be a bit, but a lot better than we thought it was going to be. We're doing a lot of our training virtually. We check in at least 3 times a day with each home. We review documentation, video review documentation. We review MARs. We review MedPass at least twice a week with different persons who are TMEs or LPNs who are in the home. The RNs check in. They all know that they can contact us at any time. And we spend a lot of time sending information to all our staff, the people in the homes, the agencies, and all. I mean, I'm emphasizing communication because these are really uncertain times, and the situation is changing constantly. So the more information that we have that we would pass on, we found it just makes it a little bit easier to dispel some of the myths and the miscommunication and misunderstandings around what we're doing and how we're doing it. We are currently planning on extending our quarantine for another 2 weeks based on the information that we're getting, and including for at least another 2 weeks, including the information that we're getting right now from the mayor's order from Wednesday. At this point, we have no additional persons have tested positive or displayed any signs and symptoms. 95% of the staff who are currently quarantined with the people have indicated they'd be willing to stay on for another 2 weeks. As you can imagine, the overtime is a huge financial commitment, and we're sort of waiting on clarification as to how this is going to be addressed. We also have some concern in regards to what happens when we get audited for cost reports and perm audits, et cetera, but have received assurances that these things, this unusual situation will be considered. Another thing we did was we applied for the Paycheck Protection Package. We're still waiting on hearing back from that. From what I understand, they're running out of money. And then I just want to say we really have no idea how this is going to end or how we even plan long term when the situation is constantly evolving. And it has appeared to me that the thing that really is going to help all of us, I mean, even communication amongst providers and all that, is that we do continue to collaborate and communicate. And yeah, that has been our experience so far. Thank you.
Thank you so much for that really comprehensive overview of all the steps that you have taken. I want to respond to one small piece of information in there, which is that the Appendix K was approved today, and so we'll be sending that out to everyone. And then we'll be able to discuss those things. One of the things that we looked at in looking at Holistic's request was, the medical necessity of quarantine in making that decision to provide the support necessary. So, and I think this, a couple things that you said that really resonated with me. One is we're all learning, and what I recognize is that our providers are learning on the front lines, and all the rest of us are also learning and doing our best to support you. Really impressed with how the providers are trying to learn this, how their staff are really stepping up and doing everything possible to figure out how to get through this and ensure the, the safety and the health of the people that we support and their staff. And we're all trying to support you as best we can, but I really want to emphasize in these calls, Winslow has given out his number repeatedly, and when there are questions, he answers that phone. I mean, he and I were on the phone half the day yesterday. And so, it is really important, that coordination, because all along the way that Holistic was taking these steps, they were taking them in consultation, as you said, with DC Health, with DDS. And it was that really helped move this along. So there's a couple of questions that people had, and I think we've been able to unmute. So first of all, Danielle, Danielle Darby from RCM, if you're unmuted, you could ask Sawida your question.
Thank you, Andy. Can you hear me?
Yep.
Okay, great.
Yeah.
Sweeta, I'm just curious. We tried to do the lockdown. We have a couple of homes with positive folks, and we can't get staff to commit to it. But B, I'm curious. One of the things we've talked about internally was how do we pay, the staff that are locked down for 14 days? Did you pay them 24 hours a day? Did you pay them 16 hours a day, 18 hours a day? Like, how did you? What did you come to as far as payment, and then what did you say to them to get them to stay?
Hi, Danielle. So the way we pay them is that we have them working shifts, and we pay them for 18 hours a day, but they work 16 hours a day, essentially. But yeah, we pay them for 18 hours a day. We have furloughed our employees who are not in the quarantine home, our DSPs. We're still paying their health insurance, and once we get some clarification about how, we will, of course, come back and bring back as many as we can. But as you can imagine, it's a really, really expensive. We're running a lot of DSP costs. Generally speaking, our employees, we don't have that much turnover in our, relatively speaking, in our settings. We had a waiting list. We called every single person and asked them if they would be willing to do this, and then we told them that we would, what the payment structure would be, and said it would be for 2 weeks. And we got a lot of people. We set up, we set it up for them. The bedding, pillows, your food will be delivered. You give us a list. We picked. I mean, we really. It was a very painful process.
Great. Thank you for the insight. Appreciate it.
There's another question that's come in for you, Sawida, from Metro Home. There's a few Metro Homes on the line, so we're just going to ask it because I'm not sure which one's on mute. And the question is, were all your locations locked down at the same time, or did you lock down on an as-needed basis?
Not all providers are coalition members. Are other providers able to proceed?
Sawida?
Hi.
I'm saying.
Hello? Sorry. So our first home that locked down on April 8th, and that was the home where we had a positive test. And right on the same day, we had a staff member informed us that they tested positive. So then we locked down the outer room. It basically took, as I said, we have 24 homes. It took us 5 days to lock down all our homes. And we just prioritized based on, we locked down our ICFs first because, they had more people in one setting. And then based on groupings by our QIDPs and acuity levels.
Yep. So, Sawida, I think that's all the questions that have come in directly for you. This is Kirk. Thank you again for all the information. I'm going to turn this all back over to Director Reese.
Okay. Once again, thank you so much for sharing that. And I mean, all of our providers are certainly doing everything they can. But I do want to thank you, Sawida, and all the staff at Holistic for the steps that you all are taking to ensure the protection of your staff and the folks that you support. And I'm really anxious to keep looking at the results of this. And I'm glad you were able to share all those measures with other folks here. So now our next question.
In terms of, this is in regards to rates, we may need to increase nurses' caseloads. Could their rates be discussed?
No is the short answer. I mean, unfortunately, so in terms of the rates that we have for the nurses right now, those are what are established in the rates for the nurses that provide waiver services. It's in the waiver. I don't know, that had not been anticipated in the Appendix K. And as I said, it was just approved. And unfortunately, we did share it as we were moving along. that was not a consideration when we were developing our Appendix K, which we shared with providers. We also looked at Appendix Ks from across the country, and that was not something I had seen, so it was not something that had been considered.
Have any details regarding retainer billing for day providers been developed?
So today, as I said, our Appendix K has been approved, and we will be sending that out to all of our providers today, and that includes how the retainer rates. It includes what the retainer rates are, and then next week we'll get out to you guidance on how those will be implemented, because for retainer payments, many of those are going to require invoices being submitted to DDS. That same thing, I think, is true for payments regarding quarantine, where we'll have to gather the information, the documentation, and then forward the invoices to DHCF. But we've been working these processes out with DHCF, and so we'll send that information out to people next week. But we will get the Appendix K out to everyone today.
How is the district reaching out to providers to assist them in preventing the spread of COVID?
So all of the communication that we've provided, you know, in terms of, there was updated guidance this week from DC Health, you know, the guidance about staying at home, about using face coverings, all of these different measures have been our efforts to reach out to the providers to provide them the guidance necessary to reduce the spread of COVID-19, which is, you know, it's guidance that's being provided by us to providers, but there's also guidance being provided, you know, by the city to all the residents of the district.
Hi, this is Daryl Hawkins from DC Health Epi, and I also want to remind them that they can also attend the weekly health and coalition calls as well. Yeah, this is Victoria Lobby with the Health and Medical Coalition. Again, we do a weekly call at 4 o'clock where we provide updates. The EPI team provides updates. Dr. Lewis and her team provide any relevant updates. We try to highlight any new guidances. It's only a half-hour call, but it's a quick way to just regularly check in. And if there are things that we need to be prioritizing from the coalition or from DC Health, we can, you know, it can be elevated on those calls. So I'll make sure that that's on Sharon's calendar so she can forward it to whoever needs to be on those calls. And again, we're here for any questions. Thank you so much.
Do we still conduct fire and natural disaster drills?
Yes, I think those should still be conducted, keeping in mind, you know, the need for social distancing as appropriate. There are certainly people who require assistance with getting outside, so they would need someone to be close to them for that purpose. But also, all of us need some time outside anyway. So make sure that your gathering place takes into account the need for social distancing between the people who gather outside. But I don't see a reason that we would be suspending fire drills during this period of time. People are struggling with, what do I do all day? This will take up 30 minutes.
Please clarify if RSA day providers are allowed the same retainer as identified for DDA day providers outlined in the Appendix K.
The Appendix K is an appendix to our Medicaid, it's to our IDD waiver as well as to the EPD waiver. So it relates to our Medicaid funded services. It doesn't relate to any services provided by RSA.
For providers who provide RSA day services like job placement, supportive employment, will RSA consider reissuing new job development authorizations to providers who may be approaching full utilization or exhausted the hours of their existing authorization? for the person they are supporting for job development authorization in order to provide continuous JD supports to the person we are supporting, in addition to provide much needed financial support to ensure viability of the RSA day provider community.
I think this question came in last week as well, and the question from the provider essentially was, can we defer providing job development until after the public health emergency and the stay-at-home order has been lifted, because a number of people we're working with could not go to work at this time anyway. And so for those people who, and I think like the example last week that I gave anyway was, if you have a person whose employment goal is to become a barber, then this wouldn't be the best time to be doing job development activities with them. And so that authorization should probably be put on hold until after the public health emergency ends. If you have a person who is interested in customer service, like, you know, wants to do stocking shelves, this kind of thing, grocery stores, Walmart, CVS, they are hiring. And if that person is interested in going to work right now, you may be able to help them find a job right now. So, you know, in terms of provision of that service, it's individualized. The time it takes to help a person get a job hasn't changed, and so when you help the person get the job will be an individual decision you'll make with them. But no, we won't be giving additional job development. If there's not a reason to do job development now, I would defer doing it until later. And, you know, for small employers whose business could be affected, you really do need to be looking at the options that are available that Sawita mentioned that their agency had taken advantage of.
Considering that some employers are not hiring and are closed as a result of COVID during these times, what concessions are being made regarding provider performance evaluation?
So the only, really the only performance evaluation measure that we have for RSA is maintaining a particular placement rate. We haven't adjusted that in our human care agreement. If we see that that is an issue, because the way that it works right now is that providers are required to maintain a particular placement rate, and when they fall below that rate, they don't get new placements, they don't get new referrals until they reach that placement, until they reach the appropriate placement rate. If that becomes an issue with individual providers, we could talk about it, because in reality, the people who they have, who they are not working on placing, could be seen as in suspended services and not count against them in terms of their placement rate. But I would just recommend, if there are individual instances where the agency is looking at suspending referrals based on a placement rate, that, that this issue be raised, and it would certainly be considered.
Are there any VR waivers being put in place for RSA day providers that RSA management can elaborate on?
No, the vocational rehabilitation and the independent living grants that we have don't have the same kinds of provisions that the Medicaid waiver has. And so these kinds of, the Appendix K that we've been talking about, the 1135 that DHCF has done, those are Medicaid provisions. In terms of RSA, you know, we're following the guidance from the Department of Education, and thus far there has been nothing. They continue to look at this.
And the last is a comment. Last comment, we feel alone and desperate.
And I get it. These are really overwhelming times. We are all dealing with a brand new experience for all of us. I do want to refer back to what Sawita said, which is that there was a period where she felt that they weren't getting the guidance that they needed. And I think that was probably a combination of we hadn't figured the guidance out and maybe they hadn't asked. I think that the best thing when you're feeling that way is to talk with someone else. One of the reasons that we wanted providers to be able to share with each other was to develop that kind of support and networking across providers. It's also one of the reasons that, from what I have seen, DC Health has been very accessible to people. DDA has been accessible to people. The quality resource specialists reach out at least weekly to everyone. Please use the resources that you have. That is the reason that we're here. I think for all of us, this is a difficult time. I check in with someone 3 times a week, and I know there are times on that phone call with them that I use part of that call to get my own support. So, I think all of us need to figure out ways that we can get support. As I hear from the mayor's presentation this week that our peak will come at the end of May, this is a marathon and we're near the beginning of it. And so people really do need to be aware of what the resources are, use those resources, connect with the people that you need to connect with so that you can continue to get the support you need. That we're all out of time, unfortunately. This hour today went by very quickly. I want to thank the people who shared information with folks. I also just want to share again with some of you, and or with all of you, I don't think it can be said enough how much we appreciate how hard the providers are working, how dedicated you and all of your staff are to ensuring the protection of all the people that we support, and that you are to ensuring their protection as well as all of your staff. I have said, as probably not enough, but as often as I can to our staff here, how much I appreciate how flexible they've been. We really appreciate, as I said today, our provider staff are on the front lines of learning about something brand new, figuring out how to do this. We are attempting to be as supportive to you in that process as we can. So just know, and please communicate to your staff how much we appreciate the hard work they're doing and their dedication to these folks. As I said, we received notification of our approved Appendix K, and we will send that out to everyone this afternoon. So thank you very much, and we'll talk to everyone next week.